All right, today we're diving headfirst into the high-stakes world of the emergency department to solve a couple of really intense medical puzzles. We've got two very different patients, both with some seriously baffling symptoms, but they share one critical link, a single organ in crisis, the kidney.
So put yourself in the shoes of the doctor on call. A patient comes in, confused, their hands flapping uncontrollably. Then another one, a young guy, is coughing up blood while his kidneys are shutting down. You see, these aren't just random symptoms, they're crucial clues in a race against the clock. Let's see if you can piece this all together as we go.
Okay, first up, our 61-year-old woman. Now, she already has a known history of kidney disease, but what's bringing her in today is something new, and honestly, it's pretty worrying. Her family's telling us that for the last 2 days or so, she's just gotten more and more confused and sleepy. And here's the key piece of information. She has end-stage renal disease, and her last dialysis appointment, that was 2 days ago. It's pretty clear her mental state is going downhill, and fast.
So during the physical exam, the doctors spot a really striking sign. When they ask her to hold her hands out, they flap, totally involuntarily. This flapping tremor, which has a fancy name, asterixis, isn't just some weird quirk. Nope. It's a classic telltale sign that points directly to a severe buildup of toxins in the body.
And sure enough, the blood work confirms their suspicions. Her urea and creatinine levels, these are the waste products that healthy kidneys are supposed to clear out, are through the roof. Her bicarbonate is low, which tells us her blood is getting acidic. But you know what's just as important? It's what's normal. Her ammonia level is fine, and that one little detail helps us rule out other big causes of confusion, like liver failure.
Let's just focus on that urea number for a second. 35.4. That is nearly 5 times the upper limit of normal. This isn't just a little blip on the radar. It's a massive red flag that our body is being totally overwhelmed by toxins that our failing kidneys just can't handle.
So you've got all the clues, right? The confusion, that signature flapping tremor, and labs that are basically screaming toxic overload because she missed dialysis. You're the doctor. What's the single most important thing you need to do right now? If you're thinking, we got to get those toxins out, you are absolutely right. The diagnosis here is uremic encephalopathy. Uremic just refers to the high urea in the blood, and encephalopathy is a general term for brain dysfunction. You put them together and you get brain problems caused by toxins that the kidneys couldn't remove. Simple as that. And that means the treatment has to go straight to the source of the problem. The only real solution here is urgent hemodialysis. This isn't just a routine session either. This is an emergency, life-saving procedure to literally clean her blood and reverse the toxic effects on her brain. So this is exactly what's going on. All those scary neurological symptoms, the confusion, the drowsiness, that tremor, they are all a direct result of that waste product buildup. But here's the best part of this diagnosis, the most hopeful part. It's reversible. You clean the blood and the brain can get back to normal. And this really shows you the diagnostic process in action. The doctors had to consider other things that can look a lot like this. Could it be liver failure? Well, no. Her liver tests and that all-important ammonia level were normal. What about a brain infection? Nope, no fever. Every single clue pointed away from these other possibilities and pointed squarely at the kidneys. Okay, so one mystery solved. Now let's switch gears to our second case, and this one could not be more different. This is case 2, a deadly cough. Our patient is just 29 years old. He was perfectly healthy until very recently, and now he's in the middle of a catastrophic crisis involving 2 different organs.
Yeah, his symptoms are just alarming. He's coughing up blood, his urine is dark, his kidneys are failing at a terrifying speed, and he can't catch his breath. This is not some slow, chronic thing. This is an acute, full-on assault on his body.
With so much going wrong at once, in both the lungs and the kidneys, the doctors know there has to be a connection. So they run a bunch of specialized blood tests, searching for that one definitive clue, the smoking gun, that's going to crack this whole case wide open.
And there it is, anti-GBM antibodies, positive. That's the answer. This test detects rogue antibodies, antibodies that the patient's own immune system is creating. And these antibodies are attacking a very specific part of his own organs. It's essentially a self-inflicted wound. This positive antibody test confirms a diagnosis of a very rare, very severe condition called Goodpasture syndrome. It's a textbook case of an autoimmune disease where the body's own defenses have gone haywire and are now launching this coordinated attack on 2 separate fronts.
So what's actually happening here? The target of this attack is something called the basement membrane. You can think of it like a specialized structural wall. The problem is, this wall is a critical part of both the tiny filtering units in the kidneys, called the glomeruli, and the delicate air sacs in the lungs, the alveoli. So by attacking this one structure, the body is waging war on two vital organs at the exact same time.
To fight back against this kind of attack, you need an equally aggressive counterattack. It's a three-pronged strategy. First, you have to remove the antibodies that are already in the blood, using a process called plasma exchange. Second, you reduce the inflammation they're causing with high-dose steroids. And third, you suppress the immune system itself to stop it from making any more of these destructive antibodies.
So let's just pull back for a second and look at the big picture. We've seen two completely different patients with two totally different diseases, but both of these stories really come together to teach one powerful lesson about why getting the right diagnosis and getting it fast is absolutely everything.
I mean, the contrast here is just so striking. Case 1 was basically a plumbing problem, right? A failure to clear out toxins, which you solve by filtering the blood. Case 2 was more like a military problem, an internal attack that you solve by disarming the immune system. Same organ in crisis, but the root causes and the solutions were worlds apart.
So what's the ultimate takeaway here? Well, it's that whether the enemy is a simple buildup of waste or a complex autoimmune assault, the battle is really won or lost on the diagnosis. Figuring out the true nature of the problem isn't just the first step, it's the most critical one for saving organs and ultimately saving lives.
You know, in both of these cases, the answers were hidden right there in plain sight. In the patient's symptoms, in their exam, in their lab results. It was all just a matter of connecting the dots correctly. And that kind of leads to a final thought. What other medical mysteries are unfolding right now, just waiting for someone to see the pattern? Thanks for tuning in.